Welcome to IVC. We look forward to helping you live as healthy and active of a lifestyle as possible. Our team is committed to providing you with state-of-the-art personalized care. IVC is nationally accredited with board-certified physicians who are fellowship trained in vascular and interventional radiology. Interventional radiologists are on the cutting edge of clinical advances and use the latest image-guided technologies in the treatment of many medical conditions that once required open surgery. Their expertise includes management of arterial and venous disease, including peripheral arterial disease, varicose veins, blood clots, and other vascular disorders. You will also work closely with our experienced nurse practitioners, nurses, physician assistants, specialized sonographers, medical assistants, and office staff. IVC is committed to helping you through each step of your care, and we want you to be as informed as possible about your condition. We hope this video will help you better understand peripheral arterial disease and the associated benefits and risks of treatment. What is PAD? Peripheral arterial disease, or PAD, damages your arteries that deliver oxygenated blood from the heart throughout the body. Peripheral arterial disease causes important arteries in your extremities to narrow and clog. This most often results from a process called atherosclerosis. The plaque associated with atherosclerosis blocks blood flow and prevents oxygen from reaching tissues. In the leg, these blockages can cause claudication, a term used to describe recurrent pain or weakness in the legs that occurs while walking, that is relieved by rest. In its more severe form, peripheral arterial disease may cause critical limb ischemia. Critical limb ischemia occurs when the inadequate blood flow and oxygen to a specific part of the body is so compromised that it results in severe rest pain or tissue loss, such as non-healing ulcer or even gangrene. Acute ischemia and gangrene require immediate attention by a vascular specialist. The symptoms of PAD. Some people experience pain or heaviness in their legs while walking, which prevents them from enjoying their lives and increases their risk of other illnesses. You may have peripheral or arterial disease if you experience one or more of the following: aching, burning, or throbbing legs, leg pain and cramping, leg weakness, numbness and tingling, non-healing wounds or ulcers. You may be more likely to have PAD if you have high cholesterol, high blood pressure, diabetes, or a history of smoking. Our team can help determine if you have PAD through a simple test called an ankle brachial index test, or ABI, that compares the blood pressure in the upper and lower limbs. Additional specialized imaging, such as duplex ultrasound, CTA, and MRA, may also be indicated for a more detailed vascular evaluation. Treatment options. If lifestyle changes aren't enough to treat your PAD, you might benefit from minimal invasive endovascular treatment. In most cases, the interventional radiologist will make a small incision in your groin and using X-ray or other imaging will guide a thin catheter through your blood vessels to an occluded or narrowed artery. Depending on the blockage location and how it looks, it may be treated with one or more endovascular techniques. Angioplasty uses inflatable balloons to open narrowed arteries. During angioplasty, the vascular and interventional radiologist guides a catheter with a tiny balloon tip through the blood vessel into the blockage. The balloon is then inflated to widen the artery, which restores blood flow. Stenting may be required in conjunction with balloon angioplasty. The interventionist will place a stent or a tiny mesh tube inside the artery to help keep it open. Thrombectomy can be beneficial if a blood clot suddenly blocks blood flow to an extremity. Thrombectomy facilitates clot removal from the involved arteries, extracting or dissolving the clot. What can I expect after treatment? Once endovascular treatment is completed, the interventional radiologist removes the access sheath and catheter and applies pressure or uses a closure device to prevent bleeding. You'll need to stay flat on your back for several hours. Usually you'll be able to go home the same day, but there is a chance you'll need to be observed overnight and discharged the following day. During a period of regular follow-up appointments at IVC, which may include ultrasound and other imaging tests, our team will monitor your progress after treatment. Most patients will be prescribed blood-thinning medications to optimize blood flow, prevent thrombosis, and optimize longer-term outcomes. We will also work with your primary care provider to help you manage risk factors for your PAD, such as high cholesterol, high blood pressure, diabetes, and smoking. In conclusion, peripheral arterial disease can impair your lifestyle and result in significant disability. With the help of our team of vascular specialists and state-of-the-art diagnostic and treatment tools, you can generally achieve significant relief of symptoms. While we cannot alter many of the risk factors that predispose you to developing PAD, we'll do our best to help you manage your condition. You'll have time to consult with us in greater detail before any procedure we perform. If you have questions or concerns, or if you're experiencing a complication following a procedure, we want to hear from you as soon as possible. Our providers are on call 24 hours a day and can be reached after hours through our office number at 801-379-6700. If you'd like more information about your specific treatment process, visit ivein.com or ask one of our providers. We hope this video has helped you better understand peripheral arterial disease and the associated risk and benefits of treatment. If you have any questions or concerns at any time, please ask one of our providers or office staff members. Thank you for your attention. We look forward to working with you.